interested to know anything about nutrition?
Nothing at all?
No?
Have a nice day.
We're gonna open a center here in September, and it's for you and for your kids, and it's free of charge.
Are you interested?
Are you interested?
It's
Puppy. Oh, he's so cute. In order for a community to become something, to be something, they need to be empowered on the issues. And right now, the main issue here is health. Because if you're not healthy, how are you gonna go to work? If you're not healthy, like how are you gonna go to school?
This is a story of 5 people that try to bring better health to a neighborhood that has one of the lowest health rates in New York City through a small office called Hope. Yes, 5 individuals help the people of Hunts Point lead healthier lives.
HOPE stands for Health Outcomes Through Peer Education, and it was kind of a little thought that I had a long time ago about how we could actually make real health outcome changes and quality of life changes in patients in Hunts Point, for residents of the Hunts Point community. So we were funded through the Office of Minority Health at the federal level to support a project which would be very grassroots in terms of improving health literacy of the residents.
This is just 1 gram of sugar? And you said it's like how many in there?
14.
14?
It says it on the side, it says 14 grams.
We went to the McDonald's site to see how many grams of sugar this has. This has 14 grams of sugar.
Look how heavy this is.
That is heavy.
I have no idea where I am.
Organization.
You have the map.
Right here.
Don't check. Can I get a left? Can I get a right? Can I take one big step for mankind? Can start with the help and work up the heart and end up with a little
I want the whole thing, but it comes
Can I get a left? Can I get a right? Can I take one big step for mankind? Can you start with the help and work on the heart and end up with a little piece of I'm a 6 train rider, a Hunts Point reside. Time to live the life. Put the cigarettes down, we'll have a better fight.
21, 45, 61.
Good afternoon, Project Hope. I think the majority of the barriers that Hunts Point have right now are due to a lot of other issues that we have absolutely no control over and that we're not going to be able to solve by ourselves. It's a community problem, but because it's a community problem, it definitely ends up being our problem. One of the kids, he's with Barbara in the supermarket now. He came this morning. I'm like, why aren't you at school? I got up late. I'm like, this is like the 3rd time that you tell me that you don't go to school because you get up late. What's going on?
Like, what's the whole point of going late? If you're gonna go to school like around the 5th period, all you gotta do is stay there for like a good 2 hours.
Then he says, actually no, I'm gonna fill out my high school application. And I said, why isn't that done? It was due last week.
That's what I said for him.
So are you done with the high school application?
Yeah.
Did you sign it?
Later, Mama.
Okay.
She signed too. Come on, John.
Never forget that education is the strongest determinant of health. Education and social economic status are the strongest determinants of health. So by me making sure that he goes to a good high school, that he's going to stay in that high school and go to high school for the next 4 years is also me reassuring that he's going to get educated, which is going to make him probably even go to college, which therefore will have better socioeconomic status, which will help him have better health outcomes.
A lot of our health status as a community can be tracked back to the rate of poverty and education. And poverty and education are pretty linked. So for example, in Hunts Point, 45% of the people live at or below the poverty level. 45%. That's almost half of that community lives at or below the poverty level. And in that same community, and these two things are tied together, only 6% of the adults have graduated from college. So when people are poor and when they haven't had the opportunity to get a higher education, there are lots of things that happen with them and to them their resources and their ability to mobilize themselves to take care of themselves or to demand certain things of their school system or of their environment is less than somebody who's had more advantage.
No, aquí no es eso, mi amor. Aquí es un centro de la nutrición. Hacemos clases y talleres para asma, diabetes y obesidad, para adultos y para los niños. Si usted está interesado, sabe alguien que esté interesado de eso, nada más dale un papel por si acaso si tú sabes a alguien.
No, yo tengo diabetes por hace 32 años, imagínate.
¿Y se está cuidando? Whatever barriers that these people are going through in order for them to get the maximum, their max of health, good health, we have to try to help them overcome it. If they said they need help with housing, tell them, well, you know, there's this section here, this program that can help you with the housing. We also tell them, before they leave, remember, in order for you to get a job, in order for you to start moving, in order for you to get Section 8, whatever it is that you look for housing, you need to have good health. You really, really need to. That has to be your foundation.